This is Dr. Allam Al Kowatli, a consultant interventional cardiologist and chief of cardiology at Emirates Hospital. Today we'll be doing a procedure on a 60-year-old male with established history of diabetes and tobacco use. Unfortunately, he's presenting with significant symptoms due to blockage of the artery of his left shoulder. We call it left subclavian artery. He's having numbness and tingling in his hands and arm, especially when he becomes active in this arm. So today what we're planning to do is to take the patient to our cardiac cath lab, do what we call angioplasty and stenting to open this artery from 95% to 0% to become almost like normal again. We just finished doing the procedure on the artery that we mentioned earlier. However, unfortunately, when we started, we found out that the artery has blocked 100% now. The artery, as you can see, is 100% blocked. There's no other flow in the shoulder at all. And that really made our task much more difficult this time. Many people, sometimes they have to quit because it's very difficult to open. But we gave it a shot, we gave it some time, and luckily enough, we were able to cross it. And you will see in the next picture how the artery was crossed in separate view and how the wire went down all the way to the arm, and you can see the catheter also went in. So that became a huge success for us. The next step now would be to open the artery completely with the balloon, and as you can see here, and then the stent, which you can see coming after. Now, finally the stent getting deployed and getting dilated at high pressure to make the artery look very normal. Look how big and healthy, juicy looking this artery is now. And let me show it to you immediately after we open it, and you can see how tight it was immediately before we start opening. So it was a huge success for us and for the patient, who probably will go home in a few hours, and he will enjoy an open artery for him and hopefully no more arm pains.